you can't do any harm. It's better to do CPR for somebody who doesn't need it and hope that they tell you stop than it is to stand back and do nothing for someone who does need it.
Hello and welcome to another episode of the HSE Talking Health and Wellbeing podcast. My name is Fergal Fox, and today we're talking about communities saving lives in the form of community first responders and CPR training. So just before we start, I'd like to thank you for listening to our podcast and ask that if you'd like to get in touch, please send us an email to healthandwellbeing.communications@hse.ie. We'd love to hear from you. And as always, if you can share the podcast with a colleague or a friend, it would really help us spread the word. Okay, so today's guest is Ger O'Dea, who's Community Engagement Manager with the National Ambulance Service. You're very welcome, Ger.
Thanks for having us, Fergal.
So, Ger, can you tell us about your role, Community Engagement Manager? What are you tasked to do?
Yeah, so I'm the National Community Engagement Manager, so I manage the community engagement team for the National Ambulance Service for Ireland. We're a team of 7. At the moment, I have 3 community engagement officers, 3 business support staff, and there's 3 new community engagement officers about to join us. So we'll have 1 for each of the new regional health authority areas. That will allow us to further develop the National Ambulance Service community engagement strategy for Ireland.
So that community engagement strategy, why are you trying to engage the community, I guess?
So I suppose we've come to learn that the ambulance service can't be everywhere all of the time. The geographical spread of Ireland, there's often delayed response times due to having to drive long distances to get to a patient. And I think communities out there are very willing to help themselves, support themselves. So we want to help them to build extra resilience in their communities to be able to save lives and be able to treat, a patient until the ambulance service does arrive at the scene.
So we're calling this episode Community Saving Lives because it is literally what it says in the tin. And the point of contact for the community is that, a cardiac arrest event. It's usually very sudden. It's a big deal.
Yeah, it's a huge deal. And to quote an English cardiologist by the name of Dr. Doug Chamberlain, he was one of the first doctors to put a defibrillator into an ambulance to deal with cardiac arrest in the community setting. And he deems that cardiac arrest is a community problem. And that's really because, I suppose, it's a member of your community that if they do not survive, they're not at church on a Sunday, they're not at the local GA game, they're not, socialising in that community, not seen in the shop anymore. So I suppose in a cardiac arrest situation, the first 5 minutes are absolutely critical, that when someone suffers the cardiac arrest, that we do CPR, that we get hands on the chest, and at the next available opportunity, get a defibrillator on the chest. And the idea of community saving lives is that we train and support members of the public and members of different agencies to respond either ahead of or alongside the ambulance service to the call and to try and implement the chain of survival as early as possible and do get those hands on the chest and do get that shock delivered if it's needed.
Yeah, I my own experience, like having done the CPR training and I think twice now at this stage to the GA club, but having seen somebody kind of collapse at, you mentioned mass there, at mass, and it was like, it was really traumatic to see somebody that just another person in your neighborhood, but like to see them fall down and then having, the people on hand there that had the skills. Like I didn't attend to her, but like it can be shocking.
Yeah, I mean, it's a big shock when it does happen to someone or even to witness something like that happening. But to have, the training in the back of your head to enable you to be able to help is what's important. And unfortunately, there has been, numerous calls I would have attended over the years myself, where you do arrive on a scene maybe 6 or 7 minutes after the 99 call has been made, and that person is lying on the ground in cardiac arrest and nobody has been doing CPR. And, valuable minutes are lost. And for every minute that goes by, the chance of survival drop between 7 to 10%. So if you do the maths on that, once you go over the 5 minutes, you're really going over the good chance.
Yeah, and the concept is fairly simple. I was surprised in terms of the compressions when you're been taught how to do the compressions, how kind of hard on you need to do them. But I suppose the concept of like the heart is stopped and you need to keep pumping the blood.
Yeah, and I mean, effectively, when somebody's in cardiac arrest, they're unresponsive and their heart is not pumping the way it should, or
Yeah.
may not be pumping at all, and that person is effectively dead. And, people had this fear for years. What if I do more harm? You can't do any harm. It's better to do CPR for somebody who doesn't need it and hope that they tell you stop than it is to stand back and do nothing for someone who does need it. And I think, a lot of public education has taken place. There's a lot more awareness around the need for CPR. And in Ireland, like at the moment now, we're at 84% of our out-of-hospital cardiac arrests that are recorded have had some element of bystander CPR. And that's absolutely fantastic, to see the people now are willing to step up and help that person.
So through growing awareness, and I think the awareness around AEDs has grown, very significantly in the last couple of years. So what you're saying is that increase in percentage of bystander CPR is kind of showing that more people have the training and more people have the confidence to get involved when they're needed the most.
Yeah, and again, it comes back to an old fear. What if I do more harm by using the defibrillator, because I'm going to be effectively delivering an energy charge to this person. But again, through public awareness and education, and even in transition year in school, the Irish Heart Foundation have a transition year CPR for schools.
Yeah, I saw that. Yeah.
And they're getting it young, and it is increasing the awareness that this machine, it's a specific piece of kit designed to assess the heart rhythm. It will not shock somebody who doesn't need to be shocked. So that fear is starting to go now, and more people are more willing to go get that defibrillator and put it on someone's chest, and then the machine takes over. It really is.
The training gives you a lot of confidence in that as well. Like, having, just as you said there, it can't do any harm, that there's a lot of intelligence in that little machine already.
Yeah, and again, as you said, the training gives massive confidence. And not only that, when you ring 999, the ambulance call taker will stay on the line with you and will explain exactly what to do. So even if it's 12 months since you did your course, or in fact, if you haven't done a course at all, they'll be able to guide you over the phone on where to place your hands, how hard to press, the tempo to press, and, they'll stay on the line until the ambulance arrives.
I think the videos are great for giving that reminders thing. You know what I mean? Like, you've done the training, it could be 2 or 3 years ago. If somebody, sat you down and asked you to write out how you're going to do this, or you're faced in a sudden shocking situation. But those videos are great reminders about the basics, and it comes back to you very quickly then when you've done with the training invites everybody to literally, shake the shoulders and go through the whole process, doesn't it?
Yeah, it absolutely does. And, whereas, as you said, if someone asks you to write it down, you probably won't remember it. But in the situation, most likely you will. And even if it's slightly wrong, it's better than nothing at all. But we do find that people come back to us and say that their training kicked in. They remembered where to place their hands. They remembered where to place the defibrillator pads. And they remembered to sing Baby Shark in their head, to get the right tempo.
That's the tempo, yeah. It was Staying Alive with the Bee Gees, I think we were playing at our training. But it's all about the rhythm, isn't it?
It is. Rate, rhythm and depth. It's extremely important that, we do pump the chest, around 100 times a minute. It's really important that we do push down hard enough in order to impact on the heart. And it's equally as important to leave your hands come all the way up without taking them off the chest. So it allows the heart to refill for the next pump. And the goal of it all is to keep the blood circulating around the body to the vital organs, in particular the brain, because what we want to happen is that we'll arrive on scene, if there's not a defibrillator already being used, that we would use a defibrillator to try and correct the heart rhythm. And knowing that someone has done CPR for the last 5 or 6 minutes while they're waiting for that to happen means that their outcome will most likely be better if they were to survive, because they haven't suffered a hypoxic brain injury as a result of lack of oxygen. And we find that people will go home to their families, as opposed to potentially end up in a care facility, because now they don't have the cognitive ability to mind themselves. Yeah. So that's why it's so important that people just get their hands on the chest as soon as possible.
Can I ask you the difference between a cardiac arrest and a heart attack? Because I think a lot of people even use those terms interchangeably.
Yeah, it's one of the most common misconceptions out there, Fergal. So a cardiac arrest is an electrical problem. where the electrical activity in the heart malfunctions, which prevents the muscle from beating effectively. The idea then is to bring an AED to the person and deliver a shock. That shock, stuns the heart, and we hope then that the heart will regain its normal beat. We further support that then with CPR to help it along. There may be times where we will give numerous shocks, or there may be no shocks at all, depending on what the machine will pick up on as the heart rhythm. Whereas a heart attack, to put in simple terms, it's a plumbing problem. It's a blockage in one of the coronary arteries, causes pain in the chest, and that person can actually go into cardiac arrest. But that's the main difference between the two. Your heart attack patient is generally sitting up, in some sort of chest pain or discomfort, whereas your cardiac arrest patient is on the floor.
Okay.
Is not breathing and is effectively, dead. So, without providing treatment and care for both types of patients, the chance of survival can be small, can be low. It's really important that they get the care they need, they get any medication they need, and they get to the A&E department
as timely as possible. So in terms of your role and the we want more community first responders, but can you explain how these kind of community first responder schemes work? Because a lot of our listeners might like to be involved in one of these schemes.
Yeah, absolutely. So our community first responders, there are 252 live groups on our system at the moment. And they range from anything from 4 people to 40 people in a group, depending on the size of an area. They're all trained to cardiac first response level for community. And the way it works then is that once a cardiac arrest call is made for where they're living and it meets the criteria for a CFR dispatch, our computer system will automatically send them a text message. So there's no human element other than the person making the call, the person taking the call. So it's completely automated. They receive the text to their phone, it gives them the address, tells them what's wrong, and they respond to the call. So what we find is that in a lot of areas, particularly rural Ireland, it is so important that these groups are responding out, ahead of the ambulance and being able to give that level of care.
Community, we want that community first responder to be in every rural area that it can be possibly needed.
Absolutely. And, it's not just, I suppose, in rural areas. If I was to have my way, I would have one in every community around Ireland.
Yeah.
Because at the end of the day, as I mentioned earlier, the ambulance can't be on every street corner. There is always going to be a travel time to it. And that first 5 minutes are so important. And there are no emergency medical services in the world really that can meet a 5-minute response time target. So, having these people out there, and they are your butcher, your librarian, your teacher, your mechanic. They're also, the local GP who might be part of the scheme, an off-duty firefighter, member of An Garda Síochána, member of a voluntary agency. There's, a multidisciplinary membership in the CFR network nationally. And they all bring, a particular set of skills that are able to treat this patient until the arrival of the ambulance service.
So these community first responder schemes, how many again did you say you have?
So at the moment we have 252 community first responder schemes around Ireland.
And you want to see more of them?
Oh, we want to see it grow. We want it to continue to grow and to be able to eventually say that we have a response for all of Ireland.
Yeah, and so the title of this episode is Community Saving Lives, and that's the focus. Having a community scheme is one of the best ways you can do it and build up your skills by bringing local people together to support other local people. Yeah,
absolutely. And I mean, they provide a response in the community, but they also provide community training, community support. And, I can give you a little story about one later where the whole thing came together, which was in a part of Cork. And what happened down there was the local CFR scheme trained a local pharmacy how to do CPR.
Yeah.
The pharmacy installed a public access defib in the village. A gentleman went to buy his morning paper, collapsed in the shop next to the pharmacy. The pharmacy staff, who were trained by the local CFRs, went in and treated the patient until the CFRs arrived with the defib that the pharmacy had donated.
Okay.
And then the rest of it kicked in, where we had off-duty staff response, we had a doctor response, we had obviously the ambulance service response, And thankfully, that gentleman, was able to come back and thank everybody involved afterwards. Again, when I say it's a community problem, he was the groundskeeper, or is still the groundskeeper for the local GA club, well-known character in the village. And he's still a well-known character in the village. Yeah. And it's when you bring all that together and you look at the chain of survival, everything that could have went right leading up to the event with the defibrillator and the training, and then during the event with the operational side of the response that was sent to him, the fruits of that.
Yeah.
You can't
put a price on that.
Yeah, you can't put a price on it. And the feeling that people get when someone they actively saved comes up to shake their hands and say thanks, that I don't think there's anything in the world like it, that would give a feeling like that,
Yeah, I wasn't familiar with that training, the community piece that the CFR schemes do. That's very important then, because they're literally capacity building out into the community so that anybody can play a role, or a crucial role, as you were describing there in that incident.
Yeah, they're pinnacle to our training. There are 300 volunteer instructors around the country linked to the ambulance service.
And how many of these out-of-hospital cardiac arrests happen on an annual basis?
Yeah, so from the 2022 out-of-hospital cardiac arrest registry report, we can tell that there were 2,802 out-of-hospital cardiac arrests, with 69% of those happening in the home.
Really?
So, when you think of that, and think of, will I do some CPR training? Well, looking at those statistics, chances are if somebody in your family or friend circle were to suffer a cardiac arrest, it could potentially, be in the home, in your home or their home. And having that training means now you're able to help them. I suppose, again, to go back on the bystander CPR, in the last 10 years, it's gone from 60% to 84%. We've won the highest rates of bystander CPR in the world.
Really?
Yeah. And so, Ireland, I suppose, the fear has gone now around doing CPR. Yeah. The fear has gone around using a defibrillator. People are stepping up and they're just willing to help, and, that is making a huge difference. We've had in 2022, we have 28 more people who have survived cardiac arrest than the year before, who are now going back out to their families.
Yeah. The video on the CFR website, I was trying to research, make sure I know a bit before this episode. I know we worked together on the out of hospital cardiac arrest strategy, but that video where you have the mother talking about, and she's been videoed in the home. I was kind of watching this video and I thought, why did they make this video in the home? And then all of a sudden her family rushes in and she says that, that she benefited from somebody doing CPR on her. Just such a powerful message to bring it home. As you said, this, when somebody survives, you can't put a cost on that.
No, you can't put a cost on it. And I suppose that particular video was funded by the Out of Hospital Cardiac Arrest Strategy. It highlights how CFRs operate, and then it does switch to that hair-raising video. Emma is a young mother with a young family. She had just fed her baby at the time, collapsed at home into a cardiac arrest. The people at home started CPR with an off-duty paramedic who was nearby that, literally ran through fields to get to the house because they could see the house across the way. And then the ambulance service crews arrived as well. And, thankfully, to be able to meet Emma and her family, in person, and know that this is a mother, a sister, a daughter, yeah. And now she's still walking around as a result of, people doing CPR and the response from the ambulance service. You can't put a price on it. We did present that video to a senior management team, and, there really wasn't a dry eye in the house. There was people with goosebumps, hair standing up. It's really impactful. And, I can guess now that everybody listening wants to know what we're talking about, but we can signpost them to it,
So we'll put that link to that website in our podcast information. I'd like to encourage all our listeners to check out becomeacfr.ie. That website is a key signpost for what we're talking about today. So coming back to your role in community engagement, so you're literally trying to support the infrastructure for these schemes. So give me an example of how you kind of get the message out to communities about how they can become a CFR member or start up a CFR scheme.
Yeah, so we use our social media channels, the National Ambulance Service, Twitter and Facebook. They're very powerful tools in encouraging people to join. We do a lot of media as well, such as, radio interviews, and, we try and tap into video media as well when we can. But word of mouth, is another great tool for us, where people meet in the pub or people meet at a match and they discuss, that they're a first responder, and then people ask how to get involved. But I suppose the unfortunate side of it is that it normally takes a tragedy in a community to realise that they could have done something to actually save this person if they had the training and they were part of a scheme, and then they reach out to us. But what we're trying to do is to get people to be proactive as opposed to reactive, and already have the infrastructure set up, in their communities to deal with such an incident. Using the website becomeacfr.ie is absolutely a one-stop shop now for anybody who is thinking of becoming a community first responder, be it that they want to join an existing scheme or they want to set up a new one. All the information is there, all of the resources there that they'll need, all the guidance, and it doesn't matter who they are. It can be, as I said, a librarian, it can be a homemaker, it can be the local doctor, or anybody at all. And I suppose to reach out, to the 100,000 staff in the HSE as well to join us. We do have a dedicated CFR scheme set up to allow members of the HSE staff to join. It's a national scheme, and it just means that they don't have to join a local community group, particularly if there isn't one.
Yeah.
But we'll still give them the full support to be able to respond in their community, and hope then that they might look towards setting up a full CFR scheme.
Yeah, so that's great. So you're inviting members of the public, but you're also saying to HSE, even if there's not that CFR scheme in your neighbourhood, you can be a part of that national. And what would they need to do that then?
So again, they can look at the website,
becomeacfr.ie,
becomeacfr.ie, or they can simply just email cfr@hse.ie, and one of the business support staff will pick up on that and get back to them with all the relevant details. So I would encourage it, to all the listenership, regardless, public, HSE, any agency at all, to at least even touch base with us and discover what's involved, because it is really rewarding to be able to provide the service in your community.
Yeah, and it's no load to carry once you do that piece of training. You must have a big army of people providing this training then. So what kind of agencies are supporting this kind of training movement? Because you're constantly training, retraining and supporting people around these skills, aren't you? Yeah,
so it was always a very big undertaking for us, because it was the community engagement officers went out and did the training. But as the network started to grow, it was becoming unsustainable. We couldn't get to everybody in a timely fashion. So what we have now is a network of 300 volunteer instructors, some attached to CFR schemes, some not, but do support their community. And they're all associated then with the ambulance service training site through the Irish Heart Foundation and the Pre-Hospital Emergency Care Council. So there's a strong level of governance as well around the training that we do, albeit very basic training, but essential training. There is, a fantastic level of support out there in the community from our instructors and from the various agencies that we're linked with.
One of the things that I mentioned earlier is that the increase in defibrillators, they seem to be loads of community events trying to kind of fundraise to buy these things. And I suppose it's great to have them. And there's definitely been an increase in my view, but what's your take on that?
Yeah, so there's been a massive increase in the purchase of defibrillators in Ireland. We estimate around 10,000 defibs to be out there in the community or private settings. Unfortunately, we only have 3,500 of them registered with the ambulance service. Now, what does it mean to register with the ambulance service? Well, it means that if a 999 call is made for a cardiac arrest, the ambulance call taker will be able to direct you to your nearest defibrillator. If the cabinet is locked, we'll be able to give you the access code for the cabinet.
Right.
So it just means that these resources are there, but need to be tapped into. You're absolutely right in that defibrillators are popping up, all over the country in communities, on the front of businesses, but unfortunately they're not registered with us. And I suppose it would be awful to think that you fundraised or purchased a defibrillator and put it in the community and it wasn't used for a cardiac arrest nearby, because it's not registered and the caller just simply didn't know about it.
Oh, so if an incident happens, if the ambulance knows about it, I suppose I was presuming that the people with those skills would know where the AED is, but like that's not always clear. So, but the ambulance have the network. If you register your AED or one in your community with the ambulance service, they can tell any call taker this is where the defibrillator closest to you is.
Yeah, absolutely. I mean, the people living in the community will know the defibrillator's there, but it's for the people who are passing by.
Yeah.
You know, it could be a delivery driver,
Yeah.
you know, who's willing to use it. That person doesn't know where that defibrillator is. If it's registered with the ambulance service, we will direct them to it during the 999 call. And again, increasing the chances of survival for the person who's in cardiac arrest.
So these defibrillators, they're popping up in every town and built up area. And is there a message around the maintenance of these machines?
Yeah, absolutely. I mean, it's grand putting them there,
Yeah.
but there is, you know, a shelf life on batteries and pads, and there's also the chance that it may have been used and put back. So, you know, for communities, they should treat the defibrillator as their own. Don't assume that the person who put it there, you know, is always going to be available to check it. People are busy, people forget. So if there's a defibrillator in your community and you're walking past, why not look at it, open it up, take it out, have a look, be familiar with it, because in times of a crisis is not the time to be trying to figure something out. Now, they're all absolutely simplistic to use. You turn them on, they tell you what to do. But if the pads or batteries are out, the machine may not work. So I think it would be important for every member of every community to take responsibility for the defib, for that AED, and to go check it out and to keep an eye on it. And, you know, unfortunately, there are cases of vandalism and theft. They're very, very small. It's less than 10, you know, we hear about every year. But at the same time, if people are keeping an eye on it and it's known that people are keeping an eye on it, chances are, you know, that it'll be untouched.
Yeah, no, very good. And you mentioned to me before about how AEDs are provided to some children that are at increased risk of cardiac arrest. Can you tell me a bit more about that?
Yeah, so one of the work streams out of the out-of-hospital cardiac arrest strategy for Ireland was to support children with life-threatening cardiac conditions by giving them a home AED. So we're linked in with Children's Hospital Ireland.
Yeah.
And when a cardiologist refers one of those children to us, what we do is we aim to deliver the defibrillator to them within 24 hours. Now, be it that it's delivered directly to the hospital or to the family home, we'll do everything in our power to get it to them within 24 hours. And then further to that, we will offer training to their family, extended family and friends, schools, sports clubs, anybody at all that they would like us to train that's connected to this child. We will absolutely do it.
So you're creating a kind of like support system around the child and their community and their family. That's great.
Yeah, it's absolutely a phenomenal success.
Yeah,
it's welcomed by all of the families, as you can imagine. And I suppose to mention Bridget Sinnott, she's Irish Heart Foundation.
Yes, Bridget, she's great.
Like, Bridget has been advocating for this for years.
Okay.
And to use her own words and not to incriminate her, she begged, borrowed and stole defibs, for these children. But now to have a system in place where we can, get the defib to them within 24 hours and provide training, it's adding, an extra layer of security to the child's condition.
Yeah.
And it's also very, very reassuring for families to know.
I'm reminded of what you said before about that community engagement, like that you said sometimes it's after a tragedy. But like if you hear of a child in either your community that has this risk, it kind of it just allows for that kind of prevention piece to come in, and you're sowing the seed of all these skills with a very wide network of people.
Absolutely, and it's a proactive approach to it, and I suppose the other side of it is that what we do as well is we link them in to the local community first responder group if there's one in their area, and they then support the family as well and bring them along to extra training. And it's also then, it's flagged with them that if I get a call for this address and it's, a young person, that chances are it is this child, and chances are that there's going to be good CPR performed because the family are trained, and that there's a defibrillator there as well. So it's adding a huge amount of resilience into the community for children like that,
One of the new initiatives you were telling me about, Joe, and we spoke about the CFR schemes in terms of the, giving us access and support in the rural parts of Ireland. But the islands, you mentioned there's work going on there to get to as rural as we can get.
Yeah, and I mean, it's important to mention the rural areas, but also just, the inner cities do have CFR schemes as well and hugely successful. But the islands, that's an austere environment. And the islands people, they know they're on their own, for a prolonged period of time waiting for help. But they're a very resilient community. The local shopkeeper is the ferry driver and the CFR as well. And what we've done is we've started to work with them to bring their skill level to a higher level. So they've done the community first responder piece, but now we're bringing them up to the level of emergency first responder, which is a 5-day course. And it just means that they can treat a broader scope of incidents that happen on islands. So it could range from anything from your cardiac arrest to a cut on a leg to a fall from a ladder. So, and then any medical calls, well, like dealing with somebody who has a diabetic incident or a seizure. And it just means that we're helping them to build further medical resilience on the islands until either the lifeboat or the helicopter can get to them. And we find that it's a huge success. It's welcomed by the islands people. And, we're just going to continue to grow that and to work with them and give them as much support as we can.
Okay, that sounds really good. Ger, I'd really like to thank you for coming in and sharing all this information, and give the signpost again there to
become a CFR.ie.
Yeah. Become a CFR.ie for all the listeners. Please check out that website. And if you've had CPR training or would like to become a community first responder, all the supports and information are there. And I'd like to thank you for listening to another episode of the HSE Talking Health and Wellbeing podcast.